Welcome to part 2 of my Get to Know Me mini-series. My name is Erica. This video series is going to be for those who are new to my channel and are wondering who I am and what I'm doing on YouTube. So in short, I have been documenting my pregnancy journey of expecting my first child while also having an autoimmune disease called Graves' disease. This is going to be the story of how I found out I had an autoimmune disease. If you want to know more about my fertility journey while having this autoimmune disease, I mentioned that in an earlier video, so I'll leave that one linked in the description box below for you to go check out. Again, this is going to be another chatty video, not visually interesting, so I highly suggest you find something to do while you're listening. So I don't actually know when I got Graves' disease or what it was that triggered it. But I have a few speculations as I kind of look back on just different symptoms that I had during different time periods in my life. So if you watched the part 1 of this series, you'll know I ended around the time that I was in Bible school. And so looking back in Bible school, I had started to notice a few strange symptoms. Whether that was with my eyesight, having double vision, or sudden change of vision when there was a drastic change in light. I was very fatigued, and people were suggesting, maybe I was just very stressed and low on vitamin B. I also started struggling a bit with my voice, and largely losing my ability to tell if I was on tune while singing. I'm not very big into singing. I've always been slightly hard of hearing and have had a quiet voice my whole life. But this is when it became particularly difficult for me to tell whether I was even on tune. So I became very self-conscious of that. And then I was also experiencing some inflammation in my gums. My teeth started to shift, I think because of gum recession that I was experiencing at the time but didn't actually notice. So when I moved back home, I started to make a trip to the doctor just about every winter for a good 3 to 4 years in a row with some of the same complaints. I was feeling unusually tired. I was physically weak. I was experiencing migraines. Just feeling very off. And my doctor would run a routine physical exam and wouldn't find anything wrong with my blood work or urine samples. And so he just chalked it up to seasonal depression and tried to put me on antidepressants, which I was not willing to take. I did not believe that was my problem, and so I would just leave it. Now you have to bear with me for a bit here. I'm going to shift gears just a little bit. It will make sense in a minute, I promise. I also was experiencing problems with my neck. I had had stiffness and immobility, struggled with a lot of pain in my neck for years, in the back on this side. And so I finally started going to physiotherapy for it and found out that there was a joint at the base of my skull that was jammed, and quite likely had been since a car accident that I had been in when I was about 14 years old. And when my physiotherapist was going over all of these symptoms that this joint problem could be causing me, I was just like, oh, check, 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 all the boxes. Migraines, light sensitivity, sound sensitivity, weakness, muscle weakness. It just seemed to really fit the bill. So I spent the next year or so gradually getting that worked on, getting that fixed, had a few setbacks along the way. But towards the end, during the last couple of appointments that I had, my physiotherapist asked me again. He had asked me this previously, but he asked me if I had ever had my thyroid checked out. Because at this point, I was still complaining about some things that should no longer have been related to the issue in my spine. And I just, as far as I knew, my thyroid had been checked with routine blood exams, and I had no reason to think that there was anything off. I was told it was all coming back normal. So I really didn't think I had any other reason to suspect that I had a thyroid issue. Then in the winter of 2019 to 2020 is when I began to notice some more alarming symptoms. I began to experience tremors in my hands, weakness, particularly in my arms and upper body. I was clearly losing weight as my clothes were getting looser and looser. I was getting irritated more easily. And during stressful times at work, I found I was just needing to go to the bathroom every 15 minutes. And then I was overheating at night, and that was causing my sleep to be very disrupted. So at this point, I knew something was very wrong. Something was not right, but I was very hesitant to keep going back to my local doctor because every other time they had done tests and everything just came back normal, and I really didn't know what else there was to do there. I was going in with this, literally writing down this growing list of symptoms that I was experiencing, and I either wasn't getting heard or they were all just being chalked up to depression. So long story short, I decided to eventually try a different doctor in a different clinic in a different town, about an hour away. This doctor came to me at the recommendation of a couple of different ladies in my church who had had really good experiences with him. I couldn't get in to see him until about the end of March. And so, the end of March, I go into my appointment, and I just remember sitting in his office, and this older German, I believe, gentleman came in with his intern and sat down, and he asked me, "So, what brought you here to see me today?" And all I could do at that point was lift up my hands like this, which were trembling at the time, and say, this is why I'm here. He took a look at my hands. He looked at me. He looked back at my chart, I think checking what my age was. And he looks back at me and he's like, "Well, it's not Parkinson's." So I had to chuckle a little bit at that. He then asked me to do some kind of fine motor skills, gripping a pen, writing on a piece of paper, just to see whether my hand would continue trembling or whether I could maintain some sense of control once I was actually gripping something. Then he had me get up on the table, and he checked my pulse manually. And at this point, he didn't say a whole lot. He just kind of looked at me and was like, "Are you nervous at all? Is it making you uncomfortable having two men in here, two doctors?" And I didn't really think so. I didn't feel that anxious or anything like that. I don't love going to the doctor, but I wasn't hyperventilating by any means. I was fine. And so he calls in a nurse, asking her to bring in a cart, basically so that they can check my blood pressure and my heart rate once again with the machine, and then she checks my weight as well. And I was shocked by the numbers that came back, particularly my heart rate and my weight. My heart rate was showing at about 120 to 130 beats per minute, in that range, and my weight was coming back at about 98, 99 pounds, which even on a 5'2" frame is not a lot. And that is a very high heart rate for essentially just having been sitting there and not doing anything. So the doctor took one look at all of that, and he said, "I'm highly suspecting this is thyroid related, but we're going to run a few blood tests to make sure that I'm on the right track here. And I'm going to put you on medication to get your heart rate under control." So he immediately put me on, I think it was 3 doses per day of propanolol to keep my heart rate under control. And over the next week after getting blood work done, it was basically just a waiting game. And sure enough, he called me back once the results came back and said, yes, you have hyperthyroidism, and you have also tested positive for antibodies that indicate you have Graves' disease, which means this is an autoimmune disease and we'll need to put you on medication, appropriate medication for that. So just like that, my life felt very altered. I was now taking medication up to 3 times a day just to be able to live a more decent quality of life. And I definitely noticed a difference very quickly. I think within 3 weeks I was just sleeping better. I started to gain back a teensy bit of weight, and just, the tremors had basically stopped once my heart rate got under control, and it was, life felt somewhat normal again. And I don't think it's until things start getting back to normal like that you realize how bad things were in the first place. It has just taken a lot since then for me to realize what was all going on and how differently even my thinking ends up being once my thyroid is under control. So my appetite was also improving. That had also been an issue. I was just constantly hungry but not having a clue what I wanted to eat. There was nothing particularly appetizing to me. Having to become dependent on medication like that is a huge change, but I was very thankful to just be able to live a bit more of a normal life again. So just as a disclaimer, I'm going to go ahead and list off the symptoms that I had, or even ones that I continue to experience. But I just want to say first off that, this list of things that I'm going to give you, I don't by any means have them all of the time. They come and they go depending on whether I'm having a flare-up or just there's other contributing factors, I guess, that can cause some of these things. So some of these symptoms are actually very similar to just pregnancy symptoms that lots of women experience. And a lot of them were also eliminated once I started on medication, but some of them have not been. So I don't know, or I can't confidently say whether these symptoms are all directly tied to whatever work the thyroid does within your body, or whether some of it is a side effect of medication that needs to be taken in order to control the thyroid antibodies. All I can tell you is these are the things that I have experienced, and these are also things that I know are very common among other patients of Graves' disease. So the symptoms that I've experienced are my hair falling out pretty much by the handful. But that was after a particular flare-up that I had this past fall, and so you can kind of see here what I have. What might look like bangs to you is not actually bangs. This is all new growth here. So all of this had fallen out. And then I've also experienced a lot of loss of muscle tone and loss of strength, which my doctor that diagnosed me explained is basically a result of your metabolism being ramped up super high, and so your body begins to eat away not only at the fat but at your muscle tone in order to try to get some form of energy. So I have really struggled to regain or maintain that muscle tone, unfortunately. I also experienced weight loss, as I mentioned, and loss of voice. This didn't just affect my singing, this affected my everyday speaking. So you may even have noticed in my videos, if you watched any of the other ones, or even are noticing in this particular video, there are days where it is just a struggle for me to get anything consistent out. I'm not sure, again, why this is, if this is related to the loss of muscle tone. Does that also affect your vocal cords then? I can't really say. But I just know that it's there, and it's something that I have to struggle with a lot some days. Some days are better than others. So I've also experienced a lot of inflammation and pain in my teeth and gums. And as I mentioned earlier, I have struggled with gum recession, which I think is what has led to a lot of my teeth shifting, particularly on the bottom, which is kind of sad and unfortunate. Basically, after 4+ years of dental work when I was younger, that has become largely irrelevant and now needs to be redone. I experienced tremors that was specifically due to a racing heart. So once my heart rate got under control, the tremors stopped. I experienced a lot of fatigue or getting tired very easily, which had become a bit of a vicious cycle as I've continued to experience that symptom, because it then leads to depression or discouragement because I feel like I just can't do certain things, or I'm trying to and it's just not working. Yeah, it becomes a bit of a mental battle after a while. But I have found that vitamin D seems to help with this a lot, whether it's taking it orally or obviously the more you can get out in the sun, the better. But interestingly, in hindsight, I think this is maybe why I was experiencing my symptoms so much more intensely in the wintertime, particularly in northern Alberta, where you're just getting very limited hours of sunlight during the day. I also experienced a lot of noise and light sensitivity. So wearing sunglasses was hugely important to me, particularly while driving. And then certain noises. To this day, I can't really say, oh, this particular noise is always going to bother me, or I think my brain just gets tired of being able to process a lot of noise sometimes, and I just so desperately want things to be quiet. I just get to a point where I just can't handle some of the background noise, like whether it's a lawnmower outside or something, and there's just a lot of things that, especially in the setting that I'm living right now, I can't control. And so that's been yet another area where I've just had to just learn to cope and try to not let myself get irritated. Which is another symptom that I was experiencing, was getting irritated very easily. Like, we're talking, it just would not make sense. I could tell that there was no reason behind why I was getting angry over things. So I would just often try as much as possible to just stuff it. Because I knew that there wasn't a proper explanation for it, and I really couldn't justify the things that were causing me to get irritated or upset. Another emotion that I would experience would be anxiety. I didn't notice this so much early on, but this past winter I was experiencing a lot of anxiety. And again, just a lot of irrational thoughts coming with that, and not really being able to communicate very effectively what it was that was making me anxious, or even being able to rationalize with myself. Like, there would just be this feeling that would come over me, or almost bubble up inside me, that just made me very tense. It would often happen in the evening, so I think some of it was, again, because of fatigue. I'm getting to the end of the day and I'm just no longer able to rationalize and properly control my thoughts. In the morning, after I'd had a good night's sleep, things would often be a lot better and look a lot clearer. And then the last two symptoms that I experienced were overheating, particularly at night, and just a lot of intense sweating with that often. And the last symptom I experienced was that I was always hungry but had no appetite. So this has definitely had a mental effect on me, and there are lots of lessons that I have had to learn along the way. I've realized I can't have a pity party. Even if I'm having a bad day. This is my life right now. Every day has been a bit of a balancing act, trying to figure out, what am I capable of, and not letting myself get stuck in this rut of I feel like I just can't do it. I have to be able to push myself as far as I can, but then also find that fine line of not pushing myself too far, because if I burn out for the next 3 days, then that's not helpful either. So it has definitely been a huge learning curve, finding out what I'm capable of and how far to push myself. But I do feel very strongly that with having this, needing to be dependent more on other people or on medication or what have you, along with a lot of other just different things that have been going on in my life, the Lord has been able to teach me a lot about dependence upon Him in times of struggle, and then also just grown me in patience. Lots and lots of patience. And made me a lot more grateful as I've realized that I can't take a day for granted. Thank you so much for taking the time out of your day to watch this, whether it's because you did just want to get to know me a little bit better, or maybe you yourself have also recently been diagnosed with this autoimmune disease. I hope and pray that this video could have been some form of encouragement or a blessing to you. And if it has, let me know by hitting the like button. Feel free to share this video with a friend, and I will see you next week for part 3, where I share our engagement and wedding story. That one will have lots of pictures, so I will see you then.